Senior must know 6. Warning signs of silent heart attack. Before it's too late. I've been a cardiologist for 21 years, and what I'm about to tell you could save your life. 3 weeks ago, a 69-year-old woman named Barbara was folding laundry in her living room. She felt a strange heaviness in her chest. Not pain, just pressure. Probably heartburn, she thought. She took an antacid and kept folding. 2 hours later, her husband found her collapsed on the floor. Massive heart attack. She survived, barely. When I visited her in the ICU, she whispered, "I didn't know. I thought heart attacks hurt. This just felt weird." Here's what terrifies me. 735,000 Americans have a heart attack every year, and most ignore the warning signs because they don't look like what you see in the movies. Today, I'm going to show you the 7 warning signs that saved Barbara's life and could save yours tonight. Let me be brutally honest with you. Heart disease is the #1 killer in America. More than cancer, more than accidents, more than anything else. Every 40 seconds, someone in this country has a heart attack. That's not a statistic. That's someone's father, someone's wife, someone's best friend. And here's the heartbreaking part. Most people wait too long to get help. They think it's probably nothing, or I don't want to bother anyone, or I'll see if it gets better. But with heart attacks, every minute counts. Every minute you wait, heart muscle is dying. Blood flow is blocked. Damage is spreading. The medical term is time is muscle, meaning the longer you delay, the more of your heart you lose. Barbara waited 2 hours. She lost 30% of her heart muscle. She'll never get it back, but she's alive because her husband knew something was wrong and called 911. You need to know what he knew. You need to recognize these 7 warning signs, not just for yourself, but for the people you love, because the heart attack that kills you might not feel like a heart attack at all. Let me tell you more about Barbara. She was 69, active, walked every morning, ate pretty well, no history of heart problems. "I thought I was healthy," she told me from her hospital bed. That Sunday afternoon, she was doing laundry, just a normal day. Around 2 p.m., she felt it, a heavy pressure in the center of her chest. Not sharp, not stabbing, just heavy, like someone was pressing down with both hands. "I figured it was indigestion," she said. "I'd had a big lunch." She took a Tums, sat down, waited for it to pass, but it didn't pass. The pressure stayed. Then her left arm started feeling tingly, like it had fallen asleep. "That's weird," she thought, but she kept folding laundry. Then the sweating started, cold, clammy sweat on her forehead, even though she wasn't hot. "Maybe I'm coming down with something," she told herself. She sat down on the couch, feeling dizzy, a little nauseous. Her husband walked in from the garage, took one look at her and said, "What's wrong? You look terrible." "I don't feel right," Barbara said. He called 911 immediately. That call saved her life. The paramedics arrived in 8 minutes. They gave her oxygen, aspirin, nitroglycerin. They did an EKG right there in her living room. "You're having a heart attack," they said. Barbara couldn't believe it. "But it doesn't hurt that bad," she said. They rushed her to the hospital. Emergency catheterization, stent placed in her blocked artery. She survived. But if she'd waited another hour, the doctor told her she probably wouldn't have made it. Here's what Barbara wants you to know. It didn't feel like I thought it would. There was no crushing pain, no dramatic collapse, just weird, uncomfortable off. If I'd been alone, I would have gone to bed, and I probably would have died in my sleep. Don't be Barbara. Know the signs. Act fast. Let's start with the most common sign, chest discomfort. But here's the thing. It's not always pain. Most people expect a heart attack to feel like someone stabbing them in the chest with a knife. Sharp, intense, unbearable. But for many people, especially women, it feels different. Let me tell you about James, a 72-year-old retired mechanic who described it like this. It felt like an elephant was sitting on my chest. Not sharp, not stabbing, just heavy, crushing. For others, it's a squeezing sensation, like someone's wringing out your chest. A burning feeling, like bad heartburn that won't quit. A fullness or tightness that makes it hard to take a deep breath. Barbara felt pressure, like someone pressing down with both hands. Location matters too. Usually it's in the center or left side of your chest. But sometimes it spreads across both sides. Duration matters. If it lasts more than a few minutes, or goes away and comes back, that's a red flag. If you feel chest discomfort that's new, intense, or lasting, don't ignore it. Don't take an antacid and hope it goes away. Call 911. All. Immediately. James waited 20 minutes. I thought it was just indigestion, he said. Those 20 minutes cost him 15% of his heart muscle. Don't make his mistake. Now, here's where it gets tricky. Heart attacks don't always stay in your chest. The pain can radiate, spread out, to other parts of your body. Let me tell you about Dorothy, a 67-year-old grandmother who woke up with jaw pain. I thought I'd slept wrong, she said. Or maybe I was grinding my teeth. But the pain didn't go away. Her jaw felt tight, uncomfortable. Then her left arm started hurting. A dull ache, like she'd pulled a muscle. She ignored it for 3 hours. By the time she got to the hospital, she was having a full-blown heart attack. Where the pain can show up, arms. Usually the left arm, but sometimes both. It can feel like numbness, tingling, or a dull ache. Jaw, tightness, pain, or a weird sensation in your jaw or teeth. Neck, discomfort that feels like a stiff neck or sore throat. Back, pain between your shoulder blades, like you pulled something. Stomach, upper abdominal pain that feels like indigestion or a stomach ache. Why does this happen? Your heart shares nerve pathways with these areas. When your heart is in distress, the pain signals get sent to other parts of your body. It's called referred pain. Dorothy's lesson. If I'd known jaw pain could be a heart attack, I would have gone to the hospital right away, she said. I didn't connect the dots. Your action. If you have unexplained pain in your arms, jaw, neck, back, or stomach, especially if it comes with other symptoms like sweating or nausea, don't brush it off. It could be your heart crying for help. Let me tell you about Robert, a 71-year-old who broke out in a cold, clammy sweat while watching TV. It came out of nowhere, he said. I wasn't hot, I wasn't exercising, but suddenly I was drenched. Beads of sweat on his forehead. His shirt soaked through. A chilly, damp feeling all over his body. I thought I was coming down with the flu, he said. But it wasn't the flu, it was a heart attack. Cold sweats, called diaphoresis, are a classic heart attack symptom. Your body is in distress. Your heart isn't getting enough oxygen. Your nervous system goes into overdrive. And you sweat, profusely, even though you're not doing anything. What it feels like. Cold and clammy, not warm, sudden, and unexplained. Often accompanied by other symptoms like chest pressure or nausea. Robert's mistake. He waited an hour. I kept thinking it would pass, he said. It didn't. His wife finally convinced him to go to the ER. He needed emergency surgery, 2 stents. He survived. If I'd called 911 when the sweating started, I could have avoided the surgery, his cardiologist told him. Your move, if you suddenly break out in a cold sweat, especially with chest discomfort, arm pain, or shortness of breath, don't wait. Call 911. Your body is telling you something is seriously wrong. This one surprises a lot of people. Let me tell you about Helen, a 68-year-old who woke up feeling sick to her stomach. I thought I had food poisoning, she said. I felt nauseous, like I was going to throw up. She spent an hour in the bathroom, feeling awful. Then the chest pressure started, and she realized this wasn't food poisoning. This was her heart. Why nausea happens during a heart attack? Your heart's distress can mess with your digestive system. The vagus nerve, which connects your heart and stomach, gets confused. Result? You feel sick, nauseous. You might even vomit. This is especially common in women. Women are more likely than men to have nausea, vomiting, or stomach discomfort during a heart attack, instead of chest pain. That's why so many women delay getting help. They think it's a stomach bug or indigestion. Helen's wake-up call. If I hadn't felt the chest pressure, I would have stayed home, she said. I would have thought it was just a virus. But she called 911 and she survived. Your action, if you're suddenly nauseous, especially with sweating, chest discomfort, or arm pain, don't assume it's your stomach. It could be your heart. Get help, fast. Let me tell you about Mary, a 70-year-old who suddenly couldn't catch her breath. She was sitting in her chair, reading a book, not moving, not exerting herself. And suddenly, she felt like she couldn't get enough air. It was terrifying, she said. I was gasping, like I'd just run a marathon, but I was just sitting there. Mary's husband called 911. Heart attack, immediate treatment. She survived. Shortness of breath is a major warning sign. Your heart isn't pumping enough oxygen-rich blood to your body. Your lungs struggle to compensate. You feel like you're suffocating, even though you're not doing anything. What it feels like? Gasping for air. Can't take a deep breath. Feeling like you're drowning. Happens suddenly, without exertion. This is especially common in women. Women often have shortness of breath before chest pain, or instead of chest pain entirely. Mary's advice. Don't ignore it, she said. Don't tell yourself you're just out of shape or it's your asthma. If you suddenly can't breathe and it doesn't make sense, call 911. Your heart might be failing to pump blood properly. Your move. Shortness of breath. Any other symptom? Sweating, nausea, dizziness. Geschaffer, call 911 immediately. Don't wait to see if it gets better. It won't, and every minute counts. Let me tell you about Frank, a 73-year-old whose heart suddenly started racing while he was eating dinner. It felt like my heart was trying to jump out of my chest, he said. Pounding. Fast. Erratic. He put his hand on his chest and felt it. Boom, 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 rapid and irregular. I thought it was panic, he said, or too much coffee. But it wasn't. His heart was in distress. Palpitations, a racing or irregular heartbeat, can signal a heart attack. Your heart is struggling. It's not getting enough oxygen. It starts beating, erratically, too fast, too slow, or skipping beats. What it feels like. Heart racing like you just ran upstairs, pounding so hard you can hear it in your ears. Skipping beats or flip-flopping, feeling like your heart's doing a wild dance in your chest. He waited 15 minutes. I kept telling myself to calm down, he said, but it didn't stop. His wife called 911, heart attack, emergency stent. He survived. The paramedic told me if I'd waited another hour, I might not have made it, Frank said. Your move. If your heart suddenly starts racing or beating irregularly, especially with chest pressure, sweating, or dizziness, call 911. Don't assume it's stress or anxiety. Your heart is telling you it's in trouble. Let me tell you about Alice, a 66-year-old who stood up from her chair and almost fainted. Everything went gray, she said. I felt like I was going to pass out. She sat back down, head spinning, room tilting, completely off balance. I thought my blood pressure was low, she said. Or I stood up too fast. But it wasn't. It was a heart attack. Dizziness or lightheadedness happens when your heart isn't pumping enough oxygen to your brain. Your brain gets starved of oxygen. You feel woozy, off balance, like you might collapse. What it feels like, feeling like you're going to faint, room spinning, vertigo. Unsteady on your feet, vision going gray or blurry. This is especially dangerous because if you faint during a heart attack, you could fall, hit your head, and make everything worse. Alice's save. Her daughter was visiting. She saw Alice go pale and called 911 immediately. Alice was having a heart attack. Stent placed. She survived. If I'd been alone, I would have passed out and died, Alice said. Your move. If you're suddenly dizzy or lightheaded, especially with sweating, nausea, or chest discomfort, sit down and call 911. Don't try to walk it off. Your heart needs help, now. Now, here's something that terrifies me as a doctor. Not everyone gets dramatic symptoms. Some people have what's called a silent heart attack. Let me tell you about Edward, a 74-year-old with diabetes. He felt a little nauseous one afternoon, a bit tired, mild jaw discomfort. I thought I was coming down with something, he said. I took a nap. 2 days later, he went to his doctor for a routine checkup. The EKG showed he'd had a heart attack. Edward was shocked. I had no idea, he said. I felt a little off, but not bad enough to worry. Silent heart attacks are especially common in diabetics. Diabetes damages nerves, so you don't feel pain as intensely. Women. Women often get subtle symptoms like fatigue, back pain, or just feeling off. Older adults. As you age, your nerves dull, so symptoms are milder. The danger? Without treatment, a silent heart attack still damages your heart. You lose muscle. Your heart weakens, and you're at higher risk for a second, deadlier heart attack. Edward's lesson. I wish I'd gone to the ER when I felt off, he said, even though it wasn't dramatic. Your takeaway. If something feels wrong, even if it's mild, even if it's vague, don't ignore it. Trust your instincts. Get checked out. Better to be wrong than dead. All right. Here's exactly what you need to do if you or someone you love starts having these symptoms. Step 1. Stop everything and rest. Sit down. Don't move. Don't try to push through it. Step 2. Call 911 immediately. Not your doctor, not your spouse to drive you. Call 911. Paramedics can start treatment the moment they arrive. Oxygen, aspirin, nitroglycerin, and EKG. If things get worse on the way to the hospital, they're equipped to handle it. If you drive yourself and have a cardiac arrest behind the wheel, you could die or kill someone else. Step 3. Chew an aspirin while you wait. If you have a regular aspirin, 325 milligrams, chew it, not swallow. Chew. Chewing gets it into your bloodstream faster. Aspirin thins your blood, which can limit the damage. Exception. Don't take aspirin if you're allergic or your doctor has told you to avoid it. Step 4. Stay calm and stay put. Don't pace. Don't do chores. Don't try to finish up what you were doing. Rest. Breathe. Let help come to you. What Barbara's husband did right. He didn't drive her to the hospital. He didn't wait to see if it got better. He called 911 the moment he saw she was in trouble. And that's why she's alive. Your plan. Have 911 programmed into your phone. Keep a list of your medications and medical conditions in your wallet. Tell your family these 7 warning signs. Make sure they know what to watch for. Because seconds matter, and you might not be able to call for help yourself. Okay, now let's talk about prevention. Because the best heart attack is the one that never happens. Here's your action plan. Eat for your heart. Focus on whole foods. Fruits, vegetables, whole grains, lean proteins, oatmeal with berries for breakfast, grilled salmon with spinach for dinner. Snack on almonds or apples. Cut back on processed foods, salt and sugar. They inflame your arteries, move your body. 30 minutes of walking, 5 days a week. That's it. You don't need a gym. Just walk around your neighborhood, dance in your living room, garden. Movement strengthens your heart, lowers blood pressure, and reduces stress. Quit smoking, if you smoke. Stopping is the single best thing you can do for your heart. Talk to your doctor about nicotine patches, medication, or support groups. Manage stress. Chronic stress damages your heart. Find what calms you. Deep breathing, meditation, time in nature. Even 5 minutes a day makes a difference. Check your blood pressure. High blood pressure is a silent heart attack risk. Monitor it at home. Follow your doctor's advice on medication or lifestyle changes. Maintain a healthy weight. Extra weight strains your heart. Even losing 5 to 10 pounds can cut your risk significantly. Stay hydrated. Drink 8-10 cups of water daily. It keeps your blood flowing smoothly. These habits aren't optional. They're life-saving. Barbara started walking every day after her heart attack. She cut out processed foods. She manages her stress. "I wish I'd done this before the heart attack," she said, "but I'm grateful I'm doing it now." Remember Barbara, the woman who ignored the warning signs for 2 hours? She asked me to share something with you. She said, "I thought I had time. I thought it wasn't serious. I thought I was being dramatic. But I almost died. If my husband hadn't been there, I wouldn't be here today. Please don't be like me. Don't ignore what your body is telling you. If something feels wrong, even if it's not dramatic, even if it's just off, call 911. You're not bothering anyone. You're not overreacting. You're saving your own life, because every minute counts, and you only get one heart." I held her hand, and I promised her I'd share her story. You're hearing it now. Barbara didn't have to lose 30% of her heart muscle. But she did, because she waited. Don't make her mistake. Heart attacks kill 735,000 Americans every year, but they don't have to. Because now you know the 7 warning signs. Chest discomfort, pain in other areas, arms, jaw, neck, back, stomach. Cold sweats, nausea or vomiting, shortness of breath, racing or irregular heartbeat, dizziness or lightheadedness. If you feel any of these, especially more than one, call 911. Immediately, don't wait. Don't second-guess yourself. Don't worry about being embarrassed. Your life is worth it. Barbara's alive because her husband acted fast. Edward survived because he went to his doctor. You can survive too, if you know the signs. And if you act. Start today. Eat better. Move more. Manage stress. Check your blood pressure. And share this video with someone you love. Because the life you save might not be your own. If this video gave you life-saving information, hit that like button. Share it with your family, your friends, anyone whose heart you care about. Subscribe, because next week, I'm breaking down the one blood test that predicts heart attacks better than cholesterol, and why most doctors don't order it. Drop a comment. Did you recognize any of these symptoms in yourself or someone you love? Your story could save someone's life. Your heart matters. Your life matters. And I'm here to help you protect both. I'll see you in the next one.